treat it. This is my model for this video, Cassidy. When it comes to the SI joint and the pelvic girdle, the function of the SI joint is it's very minimal motion. It only moves millimeters, but it helps with the transition from the upper extremities to the lower extremities in times of seated, going to standing, twisting, and so forth. And sometimes it can get locked. And when it gets locked, what's going to happen, it's going to mimic sciatica, because what happens is that when it comes to the sciatic pain, remember, the sciatic pain, true sciatica, is that you have the sacral bone, you have the sciatic nerve that goes down the back of your leg, the back of the hamstring, and it splits anterior division here, posterior division here. So this is where you'll get a lot of low back and lower leg radiculopathy pain if it's true sciatica, which the causation is different than what I want to show with the SI joint. With the SI joint, what happens is that it gets locked, and then the nerve pattern, it comes from the lower spine. And the lower spine nerves, I would say the wires from the lower spine, the lumbar spine, go down to the front of the thigh. So you have a nerve pattern down the front of the thigh, until it gets on either side of the calf. Presenting symptoms are very, very different than true sciatica, and I'm going to show you on the table what can be done about it. If she had a true, let's just say left SI joint dysfunction, now remember the pelvic girdle, it does have a rotational factor due to the transition of going from a seated to a standing, twisting, and so forth. So in her case, let's say it's a left posterior, and she will have pain. She will complain of pain from her lower spine down to the front of her thigh, and she may be walking in a very, very painful gait pattern. And one of the questions that I always ask, which is the dead giveaway, is does it hurt when you go from a seated to a standing, twisting, roll over in bed, or for females on the toilet when they're done, the tissue, grabbing the tissue, pulling their pants back up? And yes, it hurts. It will hurt. And the grade of maybe a 15 out of a 10 and maybe an 8 out of a 10. But the one thing I've noticed is that they've had this pain for a long time and nobody knows what to do about it. So when you have, let's say in her case, it's a left posterior. Now remember, the muscles, the Quadratus Lumborum and the spinal erectors, they want to protect the spine. So she'll be in a state of spasm on the left-hand side. And you'll feel it'll feel really, really tight. Because remember, it's tilted backwards to posterior. And then all I will do is here's the posterior superior iliac spine marks on the ilium, the PSIS. Usually all you have to do is just palpate it. Does that hurt? Does that hurt? Ow, it hurts a lot. Not a little, it'll hurt a lot. That's the main indicator that that's where it's rotated. Again, if it was rotated on the right-hand side, same thing. All I do is palpate the top of the glute. Okay, does that hurt? Does that hurt? Oh, that hurts. And you'll feel it. It'll feel like a little bit like a small knobby. Okay, now if you want to do an orthopedic test, do Yeoman's. Bring the leg up, remember? Bring the leg up, extend the leg back, and then push down on the SI joint. This will hurt them a lot. You'll be lucky if you get a ½ inch off the table with the palpation, because it hurts. However, the rotational factor will be fine, because remember the rotational factor is in the acetabulum. So let's bring that down. Now, one of the things, these pelvic blocks are amazing. Remember, normally if you do an evaluation, she should normally will have a posterior right and a functional short leg on the right-hand side, but that is something different. So the left side is posterior, so you want to put the wedge under her hip on the left-hand side to balance it out both sides. Now we say this, these blocks, they're not made for comfort, and because now I'm taking the pressure off the SI joint, what happens? No pain. It was tilted posterior. Now the wedge is creating a level playing field, and it takes the pressure off the lumbar spine as well. So when you palpate the muscles, the QLs and the spinal erectors, they're going to be a lot less tight. So as usual, what I'm going to do is this thing moves 100%. 33, 33, 33, and some change. So what I'm going to do is I'm going to adjust the bottom of the feet. Okay, because she takes steps every single day. And by having a toggle board, this helps out a lot with the adjustment. There's a lot of different adjustments, yes, you can do. I like to keep it very, very simple and easy. Okay, a toggle board. We have over 20 bones at the bottom of the feet. Remember, when the two bones together make up a joint, so with the adjustments, you want to restore the normal joint function, which will restore the normal function of how the way the muscle works. So you want to do the bottom of the feet, the ankles, because she takes steps every day, and since she's been out, lefty loosey, she's been in a lot of pain and discomfort, which her gait pattern on her feet had been affected. Okay, then you want to do the tib-fib joint. And again, you always want to do both. I know she has pain on her left-hand side. And I do 3 whacks, just because. Measure twice, cut once. Okay. She has the pelvic wedges supporting the pelvic girdle. The pelvic girdle consists of the ilium, the ischium, which the hamstrings tie into, and the pubis. The sacrum, the triangle bone here, 2 bones together make up a joint, the SI joint. This one is going to be the one that has a dysfunction. Why? Because 1, you take the history, 2, you watch the way she walks, and 3, they'll tell you where the pain is. Now keep in mind, when they'll say, I have low back pain. Okay, where? Is it your back or is it your butt? And they'll point to their butt. They'll give you the answer. Because a low spine is a low spine. The butt is the butt, the SI joint. Sciatica is the sacrum sciatic nerve. Okay, so when it comes to adjusting, these drop tables are amazing. I love these drop tables. For one, they're very, very safe. And 2, I just want to move that joint, as well as the lumbar bones as well. I want to move it from posterior to anterior. So I raise the leg up. I do a couple different drives. Now remember, you let them know this may hurt, but I'm not going to get you in more pain than you are already. They have a lot of dysfunction. It could be 24 hours. It could be for years. So I raise the leg up as much as I can. I want to put a lot of extension in that thigh, and then I always do a forearm contact, and I want to move it posterior to anterior. Very simple. I like to do 3 hits, because then I move it up, and I want to adjust the lumbar spine. There. Because I first did the posterior superior iliac spine, P to A. Now remember the lumbar spine too. The muscles are in a state of spasm and it's rotated. So with my form, I want to move that posterior to anterior, and then I'll just do 1 more. There you go. These pelvic blocks help out a lot with a lot of adjusting and a lot of stabilization. So then now what's going to happen is I'll palpate again the PSIS, and wow, and I'll ask them, how's that feel now? Does it feel like this? They may still be in a little bit of pain, which I always tell them that. However, it will feel almost even. Go up north to the lumbar muscles. Wow, they're in less spasm. When you restore the normal motion of the SI joint and the pelvic girdle, now let's have you get up. You'll see this. She'd be walking much different. And when it happens, it's almost instantaneous. It's instant gratification, because before, this was posterior, it was locked. Now it's moving. Keep in mind, I always tell them, yes, you may be in a little bit of pain. However, as long as you increase your range of motion and your activity level with less pain, that's the goal. Because the more activity she has, more muscle activation, what it does, it lowers the pain. It lowers the nociceptors. In addition to, when they're in a lot of pain, when that nociceptors, the pain fibers, are firing a lot, they're typically hunched over, because the nociceptors, remember, increased pain of the nociceptors decrease the ability to extend. That's just the way the body works, because she naturally wants to be folded over. So that's another indicator how she'll be standing up more upright. And again, it takes time. So if this sounds like you or somebody you know, please share this video. If not, you can just give me a call, 630-653-2225, or you could always visit my website, www.totalhealthdupage.com. And thank you very much for watching. Thank you.